Hi everyone, welcome back to the podcast series Heart Health with Dr. Rohit Sane. I'm your friend and host Dr. Aman Kapoor, and I welcome you all to the fourth episode of this series. Thank you so much for the phenomenal response you all have given to the first three episodes, and I can assure you every episode with Dr. Rohit Sane is going to be as enlightening as the previous one and probably more. In our today's episode, we'll be discussing about once the heart attack has happened, what should be done. Heart attack has happened, we have discussed about emergency measures that need to be taken after heart attack till you reach the hospital. Once you reach a hospital, some treatment is going to be given to everyone. And after the discharge from the hospital, what about rehabilitation? What should be done over there?
Okay. This is a beautiful question. Many a times post-heart attack, there are various different scenarios that could be seen. Many a times post-heart attack, people do undergo stenting with angioplasty. Few of these times, patients do not undergo angioplasty. Few of the times, we see that post-heart attack, the patient had landed with a reduced ejection fraction. The pumping power of the heart has reduced substantially. So these three scenarios are common, and one of the uncommon scenario that could be seen is that this person who has suffered a heart attack, in spite of this heart attack, he had not suffered any damage to his myocardium, to the heart muscle, and his heart muscle has been declared as absolutely healthy in spite of the heart attack. So, all these four scenarios would need the cardiac rehab in their whole lifetime to improvise the functioning of the heart in a longer run. Now the question comes in that what actually does cardiac rehab mean? So cardiac rehab is nothing else but rehabilitation of the damaged or undamaged myocardium. We have to accept this, that even though the cardiac muscle, even though the myocardium did not suffer damage in the fourth scenario, still it had undergone an insult for about 6 to 24 hours during the heart attack. Even though the patient had undergone stenting in the first scenario, still during the heart attack, the heart had undergone a kind of damage or an insult. And every heart who has undergone a heart attack, whether it has undergone stenting, whether it hasn't undergone stenting, whether the ejection fraction, the pumping power of the heart is normal or whether it is reduced, every heart would need a cardiac rehabilitation. And rehabilitation is nothing else but improvising the functioning of the myocardium as well as reducing down the overload on the heart and gradually helping the patient to get back to his original lifestyle, the work that he used to do, the exercises that he used to do, the diet planning into it, and all these things together with the diet, exercise and getting back to his own lifestyle, this whole thing is going to be called as cardiac rehabilitation. So this cardiac rehabilitation is very important for every person who undergoes a heart attack, whether stented, whether not.
Now, Dr. Sane, you have mentioned that it is very important in cardiac rehab, everybody needs to undergo. What exactly is cardiac rehab for a layperson? What does it entail? And what kind of timelines does it take to get cardiac rehab done?
Okay. So the cardiac rehab timeline will depend on the amount of damage that has happened to the myocardium, to the heart muscle during the heart attack. So if at all damage is not more than about 10 to 15% on the myocardium, the cardiac rehab could be for the smallest interval for about 1 to 2 months also. But if at all the damage that has been on the heart muscle is to a very high extent, the cardiac rehabilitation could vary from about 6 months to 8 months also. So this cardiac rehabilitation is nothing else but improvising the functioning of the myocardium so that the heart gets back to its original pumping power and it improves the blood circulation all over the body. So what actually includes in this cardiac rehab? There are few things in which the first most important thing is going to be mental rehabilitation, the psychological rehabilitation, in which post heart attack, every individual has been into some kind of thought process which normally hampers the complete productivity of that person. So, a psychological rehabilitation is very, very important to educate and make the patient aware about what actually led to this heart attack and how could he prevent in the future, which would reduce down the total stress on the individual and thus reduce down the secretion of hormones, the stress hormones called adrenaline and noradrenaline, and that would in turn help the myocardium to de-stress itself. So that is going to be the first part of cardiac rehabilitation, the psychological rehabilitation. The second part, equally important, is going to be the exercising lifestyle. If at all the individual who has suffered a heart attack starts with vigorous exercises immediately after heart attack, that could invite problems. So, an exercise physiologist has to understand the whole severity of the myocardial damage on the basis of few tests like 6-minute walk test. On that basis, the exercise physiologist could advise this patient in the right manner about what level of exercises this patient can indulge in. Based on this exercise assessment, this exercise physiologist will be able to create an exercise plan for this individual, which will in turn help this patient to improve the exercise tolerance capacity of the heart, and that will in turn help to boost the myocardial strength in the future. So the second most important thing is going to be exercise rehabilitation. The third most important thing is going to be the diet control. So with the help of dietitians or various different diet experts, the carb percentage, the carbohydrate percentage in the diet has to be reduced down drastically, and the improvement in the protein intake has to be scaled up. As well, the fat percentage in the food has to be kept as minimum as possible, and the total calorie intake has to be planned according to the patient's weight and the targeted weight loss, which will in turn help the heart to improve its functioning. So third is going to be the diet rehabilitation. And the fourth, the last but not the least, is nothing else but the Ayurvedic rehabilitation that needs to happen for this individual, in which certain procedures explained in the texts of Ayurveda 5,000 years ago clearly mention that few of the therapies which have been explained in those texts, those therapies which are called as Panchkarma therapies, these therapies normally help to reduce down the peripheral vascular resistance. Many a times during a heart attack or else post heart attack, the peripheral vessels, the peripheral blood vessels normally do get constricted, which normally increase the peripheral resistance. As soon as the peripheral resistance increases, the heart has to work a lot to push the blood supply into these vasoconstricted blood vessels. That in turn leads to a heavy pressure on the heart, which could again lead to reduction in the blood supply to the heart itself. So in this case, the best answer that comes in is to reduce down the peripheral resistance, which will reduce down the overload on the myocardium. As soon as the overload on the myocardium reduces down, the heart gets at ease and the heart starts pumping blood in a very good manner. So the fourth most important thing is nothing else but Ayurvedic cardiac rehabilitation, which will include few in the tests or few in treatment procedures, which would be called as heart failure reversal therapy or a Sampurna Hridaya Shuddhikaran from the Ayurvedic texts. Now, if this procedure has been performed, the cardiac rehabilitation would be complete by reducing down the peripheral resistance as well as improving the cardiac productivity, which will help this individual to get back to his productive life as soon as possible.
Fantastic. So, on this topic, now that you have mentioned Sampurna Hriday Shuddhikaran, your experience with developing and patenting the Sampurna Hriday Shuddhikaran therapies at Madhabad, and you have used it with thousands of patients who have benefited from this therapy. Can you elaborate a little bit more about the Sampurna Hriday Shuddhikaran therapy and how does Madhabad help in people in their rehab journey?
So, Sampurna Hriday Shuddhikaran Chikitsa or else Sampurna Hriday Shuddhikaran treatment procedure has 4 steps. It is a complete about 75 to 90 minutes procedure, and this procedure includes 4 steps. The first step is called as Snehana in Ayurveda, while in modern medicine we call it as peripheral oleation. So, this peripheral oleation, which is done in a centripetal direction, that is towards the heart. What does this mean is, a medicated oil has already been prepared by these Ayurvedic experts, and this oil is being massaged on the body in a centripetal direction, which helps to aid the blood circulation towards the heart. This helps us to reduce down the peripheral resistance, the peripheral vasoconstriction in these peripheral blood vessels, due to which the blood venous drainage towards the heart improves drastically. As soon as that improves, the heart, which was not able to pump the right amount of blood, gets in good amount of blood to its own ventricles, and this helps to the heart to pump the blood supply according to the Frank-Starling heart law. Now, the first step that we understood was about centripetal oleation. The second process, the second step of the Sampurna Hriday Shuddhikaran is peripheral vasodilatation. A medicated steam is being applied all over the body below the neck, and this medicated steam leads to a good amount of sweating, more amount of perspiration happens because of this medicated steam, and this leads to excretion of all the toxic materials, including the sodium and water content, which was entrapped into the blood vessels. As soon as these toxic materials are being excreted through the largest organ of your body called as skin in the form of sweat, that helps to again reduce down the excess fluid overload in the body and also helps in peripheral vasodilatation, thus reducing down the peripheral resistance. This is the second step. The third step that we do is called as Ruddhara, or else this procedure is also called as a decoction of medicine which is normally held on the precordial area, and this decoction, when it is concentrated on this precordial area, this helps to improve the vascularity of the intercostal vessels, and as soon as the intercostal vessels get stronger because of good amount of vascularity coming into them, their productivity improves, which reduces down the breathlessness on exertion in these patients. The fourth step is called as per-rectal drug administration in modern medicine, while in Ayurveda it is called as Basti. This Basti or per-rectal drug administration, in which about 60 to 100 ml of decoction, the medicated decoction, is infused into the anal canal, and from there this medicine gets absorbed and reaches the heart in about 6 to 8 hours. As soon as these cardiotonic herbs reach the cardiac system in about 6 to 8 hours, they help the heart as well as the blood vessels to improve the functioning, and that leads to improved productivity in this individual. So as a whole, these are 4 steps, and these 4 steps of Sampurna Hriday Shuddhikaran help the cardiac patient or a post-heart attack patient to get back to its productive life as early as possible.
Thank you so much, Dr. Sane. This was a very important and eye-opening episode. My dear friends, you may know of a lot of people around you who would have suffered from heart attack and or have undergone surgery. Share this knowledge with your loved ones. Share this knowledge with the people, those you know who have suffered from heart attack. Remember how important rehab is. And most importantly, the role of Sampurna Hridaya Shuddhikaran therapy, that is SHS therapy, how it can help a person who has suffered heart attack come back and start living a life as good as normal. So my dear friends, thank you for joining in. Thank you, Dr. Rohit Sane, for very important podcast topic sharing with us. And friends, as always, remember your work doesn't end here. You need to share this podcast with everyone whom you think is going to benefit from this. Share it with your loved ones, your family, your friends. Put it onto your social media. Let the world know that you care for them. With this, I, Dr. Aman Kapoor, take your leave and sign out. Thank you very much. Have a wonderful time. Stay safe. Till the next episode. See you on the coming Monday. Bye-bye. Take care.